I'm Dr. Scott Fuller. This show we're going to talk about insurance coverage in chiropractic. I want to talk about how your insurance plan, your medical insurance plan, works with chiropractic care. The easiest way to understand is this. If you sprain your ankle and you go for physical therapy, typically the physical therapy will last a predicted period of time. Insurance will approve a month worth of care. And depending on how you're doing at the end of that month, you might need more care that will be approved or not approved by the insurance company. But when you reach an end point, that's it. No more physical therapy will be paid for by insurance, right? That's how insurance works in a chiropractic office. If you come in with a spinal issue, as an example, a neck or lower back issue, and let's say it had a particular starting point, being the fall of 2014 right now, you raked a bunch of leaves for several hours in your yard and now your back is acting up, or you lifted an air conditioner, which you shouldn't be doing, and you hurt yourself that way. You have a fall, slip, or whatever it is. So you come in with a particular incident and now you have aggravated neck or back pain. Insurance will pay for that, and they'll pay for it to a point where either it resolves, and if your condition resolves, they stop paying. And if the condition reaches an end point, which means you're not getting any better, they also stop at that point too. Now in our office with chiropractic, what we do is we recommend a lot of wellness and maintenance care. The analogy would be is you come in with a blown engine in your car, we fix the engine, and now we recommend that you come in for an oil change every once in a while, but we clearly tell you the oil change is not paid by your insurance company. They'll only pay for the engine rebuild after things are blown. Now it sounds a little bit backwards because in the car analogy, if you decide, well, the car's running fine, I'm going to skip this particular tune-up, or I'm going to skip an oil change or two or three, that's not paid for. But then you blow your engine, that becomes paid for. So it's penny wise and pound foolish, if you will. The other analogy would be dental analogy. Let's say that you get a clean bill of health at your dentist's office and the hygienist and dentist say everything is fine. You say, excellent. From this point on, I'm not going to brush my teeth any longer. I'm not going to floss my teeth. I'm just going to skip everything, and I'm not going to come in for my regular cleaning. 2 years later, your teeth are falling out and you need implants and bridges and root canals and all of this kind of stuff. That's paid for, but the maintenance stuff is not. Now again, that sounds kind of backwards, but that is exactly how the medical care system works. And that is unfortunately how your insurance will work in a chiropractic office. So if you come in with a particular injury, an aggravated neck or back, they will pay for that until it either, number one, gets resolved, or number two, it reaches maximum improvement. They won't pay for anything else beyond that. We always educate our patients that the oil change is much better than the engine blowing up. Brushing and flossing and going in for regular cleanings, it's much better than a root canal or an implant. So we recommend the maintenance and wellness care, but it's not paid for by insurance. And that's also why we say it's not health insurance, it's medical insurance. To understand this even a little bit better, this is a handout that we give all of my patients in my office. And this is about chiropractic acute care and maintenance care. And what I love about this is right off of Medicare's website. So these are quotes. So for the Centers of Medicare and Medicaid Services, this is how they defined chiropractic maintenance care. Chiropractic maintenance therapy is not considered to be medically reasonable or necessary under the Medicare program and therefore is not payable. That's fine. We just talked about that. Okay? But it goes on. Here's how they define chiropractic maintenance care. And that's defined this way. Maintenance therapy is defined as a treatment plan, pay attention now, this is important, that seeks to prevent disease, promote health, and prolong and enhance the quality of life. Don't you want that? I certainly want that, right? Isn't that incredible? This is to prevent disease, promote health, and prolong and enhance the quality of life. That's exactly what we all want. But Medicare is saying that's exactly what we don't pay for. Also, therapy that is performed to maintain or prevent deterioration of a chronic condition. Isn't that incredible? That means, I'll give you an example. You come in, let's say you're older and you've got osteoarthritis and degenerative disc disease and degenerative joint disease and so forth in your lower back. And you've got this chronic lower back problem. And you rate it at an 8/10. So it's pretty bad. It's so bad that you can't work, you're not able to do things around the house, you're a burden to yourself, you're a burden to your family. And now you're down the path of needing over-the-counter medications, maybe on a daily basis, maybe prescription medications. We know the problems with opioid medication addiction now. That's a hot topic these days, and how many people are dying from that problem too. So let's say you have this chronic pain problem and you're under all these medications, which is expensive, and then we have to deal with all the side effects of being on those medications: kidney diseases, liver diseases, stomach problems, and so forth, never mind the addiction problems. Let's say you come into my office and we start working on your back and we're working the chiropractic magic and so forth, and we take your level 8 pain down to a level 4. Excellent. Now let's say at that point we go under maintenance care because you're not getting any better. So insurance payment stops because you're not getting any better. You find that you come in every week or every month, whatever it is, and that keeps you at a level 4. So you can be more productive and hold down a job and take care of yourself and your family and so forth. Great, great stuff. You're off the medication and so forth. Let's say we withdraw the chiropractic care. Your condition deteriorates and you go back up to an 8/10. You come back into my office for chiropractic care. We, over time, knock that pain level at an 8/10 back down to a 4/10. That is not paid by your insurance company. They call that supportive therapy, and therefore it is not paid for. No insurance company pays for maintaining you at a certain level of health and wellness either. I mean, that sounds really crazy, doesn't it? But I don't make the rules. And if you have a problem with this Medicare situation, by the way, and that translates over, every insurance company is the same way. Blue Cross, Aetna, Cigna, Tufts, Harvard, United, Mass Health, Neighborhood Health, whatever it is, this is the same rule that applies. It's just that Medicare has it strictly laid out on their website. So Medicare continues. When further clinical improvement cannot reasonably be expected from continuous ongoing care and the chiropractic treatments become supportive rather than corrective, the treatment is then considered maintenance therapy. So once again, only if you have an acute injury and if that injury and situation is improving do you have coverage. So remember, your insurance will only pay for you as if you have insurance for a sprained ankle. If you sprain your ankle, insurance coverage kicks in and it will pay until that sprained ankle gets resolved or it gets maximum improvement. Once you reach maximum improvement, insurance stops. You might even need additional physical therapy care, but you're going to be paying for that, as we call it, out of pocket. In the chiropractic world, we are all about health care. We are all about, using Medicare's words here, we are all about preventing disease, promoting health, and prolonging and enhancing the quality of life. We are all about that in chiropractic care, particularly in my office. And not only that, we couple our chiropractic care with home exercise programs for your spine, general physical exercise with workshops and consultations in my office, nutrition information in my show like this, and on my YouTube page, and workshops in my office. And I just did some classes on stress reduction and sleep. We talked about sleep just before we went on air here. So we do all of that too, and oh, by the way, that's not covered by your insurance either. So the point is only active injury and improving care is paid for by your insurance company. Once you receive maximum improvement or your condition resolves, all that wellness and maintenance care that is just perfectly described by Medicare is not paid for. So, the last advantage, however, in 2014 and beyond is this. Right now, to see me in my chiropractic office, a chiropractic adjustment costs $40. $40, that's equal to or less than a lot of your co-payments. And a lot of you have big deductibles anyway, so oftentimes we can't even use your insurance in our office. The beauty of chiropractic care is the cost is low enough where you can get the disease prevention and health promotion and prolonging your life and enhancing the quality of life in a very inexpensive way with chiropractic care. I'm Dr. Scott Fuller. Please join me again.